thinking about pharma focusing more on interaction and engagement with the payer community. There are a couple things that drive that. So I want to separate the definition of payer between pharmacy benefit manager, which is a function that's performed on behalf of the payer, and the insurer who covers the medical benefit and the pharmacy benefit. So I'm going to talk a little bit more about that risk bearer, who is that third-party insurer. So we're dealing with a lot of outcomes-based, value-based shift in our industry. And historically, these two stakeholder communities have not really been well aligned, but they can be. And an example is when you have a vaccine manufacturer and a population in a payer community who would like for their members to take those vaccines appropriately and at more utilization of vaccines, people who get them and take them appropriately. And the big driver behind that is outcomes, because the health plan wants their members to be healthier. Healthier patients cost them less from a risk perspective. So there is alignment, and what we would encourage is pharma manufacturers and working with third-party payers in looking for the points of alignment rather than the points of disalignment. And the focus is around the patient and around healthy outcomes. And so much of our focus now is around wellness and prevention. There can be a lot of alignment there. One of the things that's helping to drive outcomes and positive behavior is around understanding access based on cost. That's being driven by this new transaction called the real-time pharmacy benefit check. That happens, it's a data flow that happens when the doctor is prescribing a medication in the electronic health record, when the patient's in the office and the doctor says, oh, why don't we give you this for your condition. It also comes back with a cost estimate, and it will tell me this is the price. Well, if I have a high deductible, then I know, ooh, I gotta write that. It'll also tell me if it's on or off formulary. This creates an opportunity for pharma to come back and communicate a second piece of information, which is not just the contracted price with that payer, but I have copay programs, I have voucher programs, I have sample programs, I have patient support programs, I have other programs that can help with access. So adherence is key to a positive outcome, but I really like to say that a patient can't adhere to a drug that they can't afford to buy. And so helping this data flow all the way through and back, and then realizing that more information is better. So what is that more information? Those copays, those voucher programs, those patient support programs, patient education, but bring that data to the point of care and get it in front of the patient so there are no surprises.